Dr. Ipe Calathur. I'm an American board-certified telemedicine physician practicing in the United States. I'm going to talk today about COVID-19 because it is currently affecting every human on the face of this planet one way or another. COVID-19 is the short for coronavirus disease of 2019. Unfortunately, most of the COVID-19 deaths happening now in the United States are preventable deaths because vaccines are available in the US and all vaccines, Moderna, Pfizer, Johnson & Johnson, prevent serious COVID-19 resulting in hospitalization to a good extent. The vaccines are available now to anyone 12 years old and above at the time of making this video. A recent data from a Charlotte hospital system I work for show that 96% of patients on ventilators currently are unvaccinated patients. So if you haven't had your vaccine yet, please get vaccinated as soon as possible. The vaccine practically has no restrictions unless severe allergic reaction to the first dose of vaccine if it was a 2-dose vaccine you received. The vaccine administration can be delayed for 30 days if recent COVID infection. Yes, that is right. Even if you had COVID, you still need to be vaccinated because you can get COVID again, and second time around it can be worse. A patient have to wait 90 days if he or she received something called monoclonal antibody treatment for COVID. The more medical conditions you have, the more immunocompromised you are, the older you are, the more you need the vaccine. Get vaccinated with any of the available vaccines as soon as possible. I cannot stress that enough. You'll be doing a favor to you, decreasing your risk for complicated COVID, doing a favor to your family by making sure you'll be around for them if infected with COVID, and you'll be doing a favor to your community by decreasing the spread of the virus and decreasing the strain on the healthcare system where you live by not needing to be taken care by one of us after severely getting ill from the virus. This is the main message of this video. I'm going to talk a little bit about the virus and about COVID-19. The name of the virus is SARS-CoV-2. SARS is SARS, stands for Severe Acute Respiratory Syndrome. Coronaviruses are not new, but SARS-CoV-2 is a new kind of coronavirus. The origin of which or how humans contracted it is still unknown, and we might never know. Since it started infecting humans, it has spread all around the world at an alarming rate, forcing World Health Organization to declare it as a pandemic in early 2020. COVID-19 virus is mainly transmitted person to person. Contaminated object-to-person transmission is thought to be not as an important mode of transmission, but can still happen. It's mainly preventing getting infected somebody from a person. The virus is most contagious 2 to 3 days prior to having any symptoms. A good number of patients develop mild to no symptoms at all with the virus, and sometimes infection is misinterpreted by some as allergies or common cold. Majority of the patients are not even aware that they are spreading the virus because either they are asymptomatic, meaning they did not develop any symptoms, or pre-symptomatic, meaning they haven't developed symptoms yet. Hence the recommendation of universal masking to decrease the spread of the virus. In short, the virus can be very sneaky, and that is why it has been very effective in spreading all around the world, causing a pandemic. The virus gains access to our body mainly through our airways, through the air we breathe. There is a protein on the surface of the virus, we call it the spike protein, which attaches the virus to a receptor in our airways, following which it gains entry into our cells. The virus can also potentially gain entry through our eyes, hence the importance of wearing face shields in some settings. Once it attaches itself to the cells of our airways, it enters our cells, it hijacks our cells and uses the cells to make more viruses in the cells, and these new viruses gets released from the cell to attack more cells close by. In the process, it destroys our cell. Symptoms of COVID-19 can be like flu-like symptoms, sore throat, cough, shortness of breath, fever, body aches, fatigue, chills, headaches, and sometimes even diarrhea. One symptom which seems to be peculiar for COVID-19 is loss of taste and smell. Not all patients get all these symptoms. Like I said before, some patients get no symptoms at all. After the virus enters your body, the time it takes for the patient to start showing symptoms is called the incubation period. The incubation period for COVID-19 can be up to 14 days, but majority of the patients start presenting symptoms within the first 5 days. That is why the 14-day quarantine period for somebody who had an exposure to the virus. Majority of the patients with good immunity can get rid of the virus without much problems, but patients with decreased immunity and multiple medical conditions can get severe and life-threatening complications from the virus. Even though rare, there are also many instances of healthy individuals who have died from the virus. These cases are from patients' own immune system going into overdrive, damaging the patient's body itself instead of damaging the virus. Some healthy young individuals who get complications from the virus are also found to be struggling from obesity, making it one of the important risk factors for severe illness. The risk for severe illness vary by age and underlying comorbidities, like I said. The most common reason for a patient with COVID-19 to get admitted to a hospital is COVID pneumonia, which is infection of the lung. When lung is severely infected, the oxygenation of the patient declines, resulting in failure of breathing or a respiratory system, and in a lot of cases, a condition called ARDS or adult respiratory distress syndrome happens. This is a condition where the lung stiffens up with extremely poor oxygenation of blood. Normal oxygen saturation of your blood is 100%. It can be measured using a device called pulse oximeter, which you've probably seen in office settings. But you could sometimes some of the smartwatches can measure it for you. When a patient's oxygen saturation drops to less than 90%, the patient is in trouble. That is when patients require oxygen supplementation. If oxygen gets a lot worse, a simple oxygen supplementation would not work anymore, and that is when we have to put patients on something called CPAP or a ventilator. Ventilator at this point is not an option, but needed emergently to prevent immediate death of the patient. Once a COVID patient is on ventilator, unfortunately around 30 to 60% of them will never come out of it and unfortunately die. 96% of patients right now in Charlotte area where I practice in North Carolina are unvaccinated. The statistics is similar all over the country. This is the importance of getting vaccinated. Other complications of COVID-19 are blood clots, strokes, heart attacks, heart rhythm problems, permanent scarring of lungs, sometimes permanently requiring oxygen, sometimes even requiring lung transplant, chronic fatigue, among many of them. I'm going to touch barely about some of the management of COVID-19. This is just to give you a general idea. So most of the COVID patients are treated at home by Tylenol and fluids, and most of them get better. If you're vaccinated, your odds are the best. If unvaccinated, unfortunately, you're at the mercy of the virus, but still, odds are in your favor if you're a healthy individual. Patients who have risk factors for complicated COVID-19 like age above 65, diabetes, obesity, kidney disease, liver disease, active cancer, patients getting some kind of biologic injections for certain conditions like rheumatoid arthritis, we give them a medication called Regeneron, which is a monoclonal antibody treatment. You probably heard about this medication because US President Trump received the treatment when he contracted COVID. This is an infusion given in an outpatient setting, and again, it is given to patients who do not have severe COVID yet, but at risk for it. So it is approved by FDA for emergency use, and hence it is a new drug, and unknown side effects can happen, even though it's very rare. Fever, chills are common with this medication. Patients are admitted to the hospital, like I said, when the oxygenation drops. So when regular oxygen supplementation fails, CPAP will be tried. We're trying to avoid the ventilator, and if that fails to oxygenate enough, that is when the patients will be put on ventilators for respiratory failure. If that fails to oxygenate, meaning the lungs are badly damaged, that is when we would try something called ECMO, which is extracorporeal membrane oxygen, which is a machine which takes over the function of lungs in oxygenating blood. In some patients, the lungs are permanently damaged and they have to be on ECMO until lung transplant. Unfortunately, lung transplants are hard to come by, so most of these patients ends up dying. So there are roles for steroids and a medication called remdesivir and another medication called tocilizumab in hospitalized COVID patients. These are not magic treatments. They improve outcomes, but many patients still die from COVID even after being on all these. Hence, none of these are a substitute to vaccine. Patients who had mild COVID usually recovers completely within 2 weeks. Patients with severe COVID-19, if recovered, can take up to 2 to 3 months to recover to their baseline. Some patients are left with long-term consequences which would never improve. The most common persistent symptoms include fatigue, difficulty breathing, chest pain, some chronic cough. Some patients have chronic memory issues. Sometimes we call it COVID long haul syndrome. So bottom line, if you're not vaccinated, healthy or unhealthy, young or old, be smart, get vaccinated. Don't put yourself at risk for severe COVID. I have some patients who tell me they're very careful, they don't go anywhere. The next thing I hear, they get calling me saying that they got COVID. They could get COVID from a grocery store. They could even get COVID from my waiting room in my office, because this is a very effective virus. So that is not a valid excuse. The sad reality is no one is safe from it. Hope this video convinced some of you to get vaccinated if not vaccinated. So bottom line, get vaccinated, wear a mask and do social distancing in public places, and also ask your friends and family to get vaccinated. I'm going to make a small video about the available vaccines so that patients can be more comfortable with them, and hopefully encourage people to get more vaccinated. So take care. Bye.